Greetings again, welcome back to this channel. I hope you enjoy what we discuss here. So in our previous episode where we were talking about kidney health, we measured more about the general health of your kidney and how you can ensure the measures you can take to ensure that you maintain a healthy kidney, or to protect your kidney whenever you start or suspect that you might be developing a kidney failure. However, in this episode, I want to distinguish it clearly, the two major categories of kidney disease, whereby we have the chronic kidney disease and acute kidney disease. Your kidneys can either fail overnight, just within a short period of time, or they can fail and develop a problem silently within months and even years. And that's why it is important to have this information so that it can help you prevent such occurrence either to you or to your loved ones. So when we talk about kidney problem or your renal health, there are normally two major categories that it is grouped into. You can either have acute kidney disease or acute kidney injury, or a chronic kidney disease, whereby the one and major difference between the two is that acute kidney disease develops within hours and days. It is just developed suddenly out of maybe a primary cause that you might be having. However, chronic kidney disease is the one that develops slowly without your knowledge, without showing any signs and symptoms, silently into 1, 2, 3 years before you notice any abnormality within your system, unless you go for a creatinine test or you do a lab test or a scan. So to begin with, let me try and elaborate what acute kidney injury is, or acute kidney disease is. Acute kidney disease is the one that develops suddenly within hours or days, and if dealt with urgently, it is reversible and your kidneys can be restored back to normal. And this acute kidney disease can be due to several problems or conditions, and the causes can be either pre-renal, they can be intrarenal, or post-renal. In other language, the causes can be before substances reaches your kidney. It can be due to a problem within your kidneys, or it can also due to a problem after your kidneys, that is below your kidneys during the tubular phases. Now, when we talk about pre-renal causes, this is majorly due to reduced blood flow to your kidney. Blood flow. Remember, when there is a reduced blood flow, there is a reduced oxygen that reaches your kidney and all sort of things. So when your blood vessels are blocked and not enough blood can reach your kidneys, then their function is going to be interfered with, since not enough nutrients, not enough oxygen can be able to reach your kidneys, and this can suffocate them, leading to them developing an injury or a damage. The obstructions can be due to various things. Maybe you might be developing a tumor that blocks your blood vessels, or maybe you might be having an embolism, that is clots within your blood vessels that are blocking blood flow into your kidney. The obstructions can also be due to low blood pressure. Low blood pressure, that causing not enough blood flowing into your kidney. And it can also be due to low cardiac output due to heart problems, heart failure, and all those kind of things. So those are some of the pre-renal causes of acute kidney injury or acute kidney disease. And there are also intrarenal causes. These are causes that are within your kidney itself that can also lead you to developing acute kidney injuries or acute kidney damage. So majorly these ones can be due to infections. You are having a serious infections, things like acute tubular necrosis. Maybe you are having an autoimmune disease that affects your kidney, all due to nephrotoxins. These are substances that can easily damage your kidney, substances that maybe you take that can easily damage your kidneys. And one of these substances is the contrast dyes that are used in CT scan. When you are into CT scan for quite some time and you use this contrast, and remember this contrast is cleared out through your kidneys. Too much use of these contrasts can cause a problem to your kidneys, and that's why when you go for a CT scan that requires contrast, you have to check for your creatinine levels just to ensure that your kidneys are still functioning properly, in order not to cause more damage to them, because this contrast seems to be interfering with your kidneys when they are trying to clear them. Another example of nephrotoxins are the antibiotics that we use, especially during self-medications. The medications that you take without prescriptions, they also damages your kidneys and can lead you to developing acute kidney injury, which if not managed, then you will develop a chronic kidney disease. So avoid self-medication as much as possible. Some of the antibiotics that you buy in your these pharmacies without prescription, especially things like vancomycins and gentamicins, they are really not good for your kidney health. So those are some of the intrarenal causes of acute kidney injury. The third cause of acute kidney injury, we have the post-renal causes. And post-renal causes, these are just due to renal blockage after the kidneys have filtered all this waste product, and now there is a blockage or due to a problem in your tubules or all that, then the waste products cannot be cleared out of your system. Then these substances can accumulate and cause damages to your kidneys if they are not cleared out. And one of the major causes of this post-renal acute kidney injury are the kidney stones. That's why it is important that you check for all that during your checkups. So those are some of the major causes of acute kidney injury. We have the pre-renal causes, the intrarenal causes, and the post-renal causes. Acute kidney injury is reversible and can be restored if managed early. If diagnosed early enough and you are put into management, you are able to restore your normal kidney function. So it is important that when you notice those signs, and symptoms of acute injury, or you develop those primary conditions that interferes with your kidney functioning, that is important that you seek medication urgently, especially you check on your kidneys as well, just to ensure that they are protected. So that is how acute kidney disease develops. Number 2 type of kidney disease, we have the chronic kidney disease. This is a kidney disease that develops over months and years silently without you noticing. And the bad thing with this is that it is irreversible. Once you develop a chronic kidney disease, then it is irreversible. The only thing is that it can be controlled and managed so that your lifespan is increased if it is diagnosed early enough. And the only thing about chronic kidney disease that can help is that if you do a regular checkup, you check for your kidney function. At that point that you feel everything is okay, you just check your kidney performance. And one of the major risk factors of this chronic kidney disease are the ages. Most of your system organs, especially the kidney, tend to lose their function as you grow older. So the elderly are most likely at risk of developing chronic disease. That's why it is important that as you grow older, it is important that you do this early screening for kidney disease. 2 major primary causes of chronic kidney disease are the diabetes and hypertension. Just as we discussed earlier in our previous episode, diabetes and uncontrolled pressure. It is important that you manage the two to reduce your chances of developing chronic kidney disease. And we also have autoimmune disorders that can cause chronic kidney disease. Some of the genetic disorder that you might be inheriting within your families. That's why it is also important that if there is a trend in your families where that quite a number of people have CKD, it is important that you start screening earlier so that you manage your kidney and you reduce the risk and chances of developing chronic kidney disease. We have got what we call polycystic kidney disease, which is an autoimmune and genetic disorder that is linked most of the time to your family, that can also and is also a major cause of chronic kidney disease. And we also have conditions like nephrosclerosis, which is also a cause of chronic kidney disease. So that's all about the two types of kidney disease. Acute develop suddenly within hours or days. Chronic develops silently into years and months. Acute kidney disease is reversible if managed and diagnosed earlier. Chronic kidney disease is irreversible. So it is important that you take note of the two, as that will help you in managing your kidney health. Thank you for watching. Keep following for more and see you in our next episode.